Welcome to 72 Dragons Health. Today we had the pleasure of speaking with Sonya Erlich. Welcome to this interview, Sonya Erlich. It is an honor and a pleasure to have you with us today.
Thank you for having me.
Sonya Erlich is the Deputy Director for Workforce Development and Training for Team Up for Children. She has proactively worked towards improving the health and wellness in communities. Her work involves helping organizations in creating work environments that uphold and encourage their staff members. In addition, she provides psychotherapy to individuals of all ages and has experience in teaching, clinical supervision, and mind-body therapeutic approaches. My name is Dr. Pietro Aparicio from 72 Dragons Health. Thank you for joining us and for sharing your experiences with us. Without any further ado, let's begin. Sonia, can you tell us about your current role as a Deputy Director of Workforce Development and Training for Team Up for Children? How do you see your work contributing to public health?
So first and foremost, I'm always a clinician, but we have seen over the years that there are not enough of us in the field. And so a big part of what I do in my role as Deputy Director of Workforce Development and Training is to help build the field, to do the on-the-ground training with various people on care teams, whether that's clinicians, people trained at the graduate level to be mental health clinicians, or community health workers, or primary care providers, so that all hands are kind of on deck to be assessing for diagnosing and thinking about mental health. And then another piece of it is that workforce development. So really thinking about the context, the environment in which people are working. We saw people just leave the field in droves during the pandemic, and we really want to make sure that people are in places that are sustainable, that are healthy for them, that are thinking about the container for the caregiver, not, of course, thinking about the type of care delivery, but also thinking about the people who are delivering that care.
Thank you for sharing. And you mentioned a little bit about it, but how has the Team Up for Children organization benefited children enduring behavioral health issues? And can you share the strategies adopted by your team for the prevention and treatment of these issues?
A big part of what we do, we partner with healthcare institutions. We have deliberately started our partnerships in the federally qualified health centers in Massachusetts, and now we're expanding to other types of institutions. But we have been really consciously trying to partner with organizations that meet children in their everyday contexts, that meet people in their medical homes where they're already going for care, so that it doesn't have to be an extra step to be thinking about mental health, or to be, to have an additional motivation to go somewhere else. In these environments, we are able to support increased screening for behavioral health needs, so that mental health issues are identified earlier, and treatment can occur earlier in a comfortable, familiar environment. As I mentioned earlier, we provide teaching and training for the workforce in the medical homes. We provide evaluation support so that the care that is occurring is really data-driven, and that the people working there can constantly be, there's sort of a constant feedback loop around how services are received, how care is being delivered, and then the people that work there can sort of be constantly assessing for needs and gaps and adapting their workflows.
Great. You mentioned the federally qualified health centers. Can you share about the film, The Only Constant is Change, how federally qualified health centers meet the moment, which was showcased at the American Public Health Association Film Festival 2023 in Atlanta, Georgia. What do you hope to gain from this film?
So in the film, I interviewed people from both South Boston Community Health Center and Dot House Health Center. Both are Boston-based federally qualified health centers, and they are both health centers that have partnered with Team Up. If you watch the film, you'll notice a lot of people are masked. You'll notice a lot of the interviews are happening with just one person at a time because we still were very much in the COVID pandemic at the time. And really, what I wanted to do was elevate the voices, the people, the care that was occurring in the federally qualified health centers during the pandemic. During the pandemic, FQHCs led the charge in getting people vaccinated, in making our entire country safer. And people were there. You know, they didn't, as they said, someone said in the film, they didn't miss a day. They adapted their workflows. They sort of changed all of their processes to keep showing up for people throughout one of the biggest crises, public health crises, certainly in my lifetime, but really that many of us have faced. It was unprecedented for many of us. And so I really wanted to elevate not only just the work that continued there, but also the way that they were able to provide integrated behavioral health services during one of the biggest mental health crises that this nation has seen.
Thank you. And I know the federally qualified health centers mostly focus on marginalized communities. Can you talk more about that work in marginalized communities and the work with children?
There's a quote that I'm not remembering exactly right now, but it's basically like, if we create our world to treat the people who are most marginalized, if we create systems that are really mindful of the people most in need, and the people at the areas, the populations who have historically received the fewest resources, then we're really creating a better world for everyone, because it means we're being mindful of the things that really all human beings need. And so we were very deliberate about, the Team Up was very deliberate about partnering with federally qualified health centers, really as a social justice and health equity matter. We really cannot elevate the health of this country without reaching people who have been historically marginalized in this country. Federally qualified health centers are all over the country. They're in rural areas, they're in urban areas, less so in suburban, but they're all over the country. Tend to be sort of a one-stop shopping for the people that seek care there. There's often dental health, behavioral health, transportation services. There's the housing resources. Really, they are intended to be a safety net for anyone to show up and be able to access at least some of the things that they need.
Yeah, health equity. It's very important. Now, what are some of the future projects for Team Up? And is there any new film production on the horizon?
I actually have done another film since this one came out, the one that you saw. And it was featuring Brockton Neighborhood Health Center and New Bedford Community Health Center, also federally qualified health centers in Massachusetts, just south of Boston. They are both neighborhoods where people have the majority of their clientele are not originally from the United States. Many people have very recently immigrated here. And so, things like how to serve people in the language that they are most comfortable speaking in, how to build a culturally responsive staff workforce. Those are really pressing issues. And so this next film that I did was really looking at how these health centers, being embedded in communities, are best equipped to provide culturally responsive care, and really should be leading all of those conversations on how to do that. And then I'm just starting another film project, and that's a celebration of the work that has happened over the past 4 years with the 4 health centers that we've been collaborating with.
Sounds wonderful. Looking forward to see these new films productions. Sonya Erlich, Thank you for your dedication and contributions to the field of behavioral health and community medicine. Your commitment to addressing the issue is truly commendable. We're thankful for your leadership and your passion for making a difference in the lives of children. Thank you.
Thank you so much. Thanks for having me.